Hey, what's going on this week?
Hey, let me show you. Hey guys, welcome to this week's short and sweet edition of Monday Memos. This week we're going to be on the move because my videographer decided he was going to go on vacation. This week's edition of our Monday Minute with the Doc is with Queen Rorick.
Good morning and welcome to Her Majesty's Medical Minute. So today I thought I would briefly touch upon medication that's a little bit new to our usage for the treatment of nausea and vomiting, but one I think that you've seen me personally use more frequently in the ED, and that way we can just kind of communicate with our patients and let them know that it is used for different purposes and that it's also a treatment option that we have given we've several medication shortages such as IV Zofran and IV Reglan. So here's an alternative. It's called haloperidol, also known as Haldol. So all the way back to 2004, it actually has started to be studied in the setting. It is an off-label use for the treatment of chemotherapy-induced nausea, vomiting, as well as nausea and vomiting in like terminally ill patients. How does it work and why is it an alternative? Well, a lot of our antiemetics that we commonly give, like Compazine and Reglan, are actually dopamine antagonists, and haloperidol is as well. So it only makes sense that it's working on similar receptors to some of the other medications that we commonly currently use. So if we order it and the patient, which we've had already occur, they Google it on their smartphone and they say, this is an antipsychotic, I refuse this medication, I'm not going to take it. We can kind of have a little discussion with them that it is being more widely used for the treatment of nausea and vomiting, most commonly for post-operative nausea and vomiting, but we are seeing an increase in its clinical use because of the shortage of these medications we have. So who should we use it in? Who should we not use it in? Definitely avoid using it in patients over the age of 65 with any type of cardiac issues. Avoid it in patients that have significant electrolyte abnormalities, hypokalemia, hypomagnesia, and definitely not appropriate for the pregnant patient and not appropriate in the breastfeeding mom. So just a little synopsis about haloperidol. I'm always willing to talk about it. You can ask me some more questions, but until next time.
Before Jose decided to leave us, he did record a piece of his passion, patient experience.
All right, guys. Danielle said that we have to talk about patient experience. But first, we got to take a field trip. Hey. Hi. Sorry for the ambush. Guys, this is
You're
Julie.
Not sorry.
I am sorry. Julie, tell the team what you do, who you are, and why I've invaded your private space.
My name is Julie Burke, and I'm a patient experience manager for Popka and Winter Garden, and I do a lot of process improvement initiatives for patient experience and employee engagement. I kind of help in that arena as well.
Boom. So, as you know, we're all doing some validation right now. We're following you guys around, making sure you guys get the communication board down pat. Just because it directly affects something that we've been tracking lately, not lately, but we've always been tracking, which is our informed about delays.
Just more intentional.
Yeah, we're trying to be more intentional, making sure that we're actually putting the right amount of effort, not just doing it to do, but actually being intentional with our actions. So it's always been kind of up and down with Winter Garden, so we're just trying to be intentional and actually trying to put in the right amount of effort and the right type of attention with communicating with our patients. So Julie here is actually going to talk about another thing that's kind of a hot topic with our patient experience scores, and that's scary. What is it? What do you say? How do you say it?
What, the informed about delays?
No, the other caring about it.
Staff cared about a patient.
Boom.
So we have a tool that you can use. It's called the Priority Index, and it tells you basically where you can get the biggest bang for your buck. So what's highest correlated on the survey to the patient's overall satisfaction. And one of those things that I was saying wouldn't fall off, even if you were scoring very high, is staff cared about me as a person. It's just that important to the patient. And informed about delays is on there too. Basically, in patient experience, in any service line you're in, if you can educate the patient, communicate with the patient, and show them that you care about them as a person, you're pretty much going to hit the mark if you're doing it consistently.
Right. Now, when they say care about as a person, does that mean that they just don't want to be treated like their job to be done?
Yeah, a task. We see that a lot in our comments. So when there is a negative comment, or even when it's not completely negative, a lot of our patients are just giving us 4s instead of 5s. So it's not that they're unhappy. There was just typically that one time where someone treated them like a task. So that's typically what we see. We don't actually have a lot of very unhappy patients statistically.
Right, and it's mainly just that, right? That we can do a little bit better treating them as people and not just something that I check off that I did today, right?
Yeah.
Like completing an order.
Right. Well, and the one thing to keep in mind in like the ED, for instance, is much more competitive than inpatient. So keep in mind that you're constantly competing against all of the other EDs in the nation, which right now is over 2,000. So you have to exceed those expectations to perform higher than they are. So even if you're in the 90s, you might not be hitting goal because everybody else is already there as well.
Right, and we're pretty competitive.
Well, yeah, the best analogy that I've heard a nurse tell me is it's kind of like walking up a down escalator. And as soon as you stop moving, you're going to start sliding backwards.
Gotcha. Well, I don't want to be left behind.
No.
Julie, thank you so much for just clarifying how to look at that. So,
you're welcome.
Don't treat our patients like they're tasks. Treat them like real people. Treat them like you want to be treated. Treat them like a dear family member.
Stacey.
It's my wife. Anyway, bye guys. Thank you, Julie, for your time. I
welcome.
appreciate it, and I apologize for the ambush.
No, you don't.
And again, like I was saying,
Whoa, Danielle, I'm not finished yet. Real quick, guys, one more thing we're going to talk about real quick. I know that we talked about this during our huddles this week. We're trying to expedite getting our patients to CAT scan, especially if there's an order for contrast. I know that we're pushing the iStat creatinine cartridges right now for anybody that is ordered IV contrast for CAT scans. However, one of the things that did come up during our huddles when we talked to Kyle is we are looking at longer delays for pregnancy tests as well. So when the patient gets to the room, ensure that we can get a urine test as soon as we possibly can so we can get that exam done. If they're not ready to give us a urine specimen and we're doing blood work anyway, Danielle took a field trip down to the lab and talked to Rada, and we did get some education as far as how they test pregnancy, serum pregnancy, if it's through blood. So they actually use the same cartridge as their urine to check if you're positive or negative in a pregnancy test. So it's still easy. So if you know you're going to have a delay in getting a urine specimen just to find out if the patient's pregnant or not and you're sending blood work, just order a serum pregnancy because it's going to be easily as quick as a urine. They're just going to drop a couple of drops of blood in the cartridge, the same cartridge we use for the urine specimens, and that'll give us a negative or positive for your HCG.
well, that's all I have for you guys for this week's edition of Monday Memos.